wellness revolution starts now.
Okay, hello, welcome to the program. I'm Elena Mango, Vice President of Braidwood Management, and I'm joined by Brianna Gregory, who is a pharmacist at Physicians Preference Pharmacy. And today we're going to talk about the benefits of oxytocin. So, Brianna, welcome.
Thank you, Elena. It's a pleasure to be here. I'm excited to dive into this topic today. This is a really good one.
I am too. We get lots of questions about oxytocin. So why don't we just start with the basics and talk about what is oxytocin?
So oxytocin is something that our body naturally makes on its own in very high levels, actually specifically as women. We make higher levels than men do. Oxytocin is a neuropeptide transmitter hormone. So basically, it works as a communication agent in the body to tell other cells what to do and how to function. But we oftentimes will use oxytocin in our guests that have hormone deficiency because it does work as such a good signaling agent there and tells other hormones how to work. Typically, people will think of oxytocin as the love hormone. This is oftentimes how it gets deemed because it's the cuddle hormone. It's the hormone that's released after intimacy, and it wants to pull us closer together. It's the social bonding hormone. It's also the hormone that makes mom and baby come close. It assists in breastfeeding. So it actually has a lot of different benefits in the body.
Okay, so how does it work specifically?
So one of the interesting things about oxytocin is that it's present in a lot of different areas in the body. So when we think of it as being the love hormone, we think about it being primarily present in the breast tissues and the ovaries and the testes, areas that are directly related with sexual function. And that's true, but actually oxytocin is very highly densely located in the central nervous system. So when we think about patients that don't sleep well or that have a lot of anxiety or who have really struggled from different situations like social isolation or really traumatic experiences, even childhood abuse, we think about these types of people that we can use it in. So your question is, how does it work? Oxytocin, when we give it exogenously, which means that we're just taking it in from the outside, essentially in a medication type form, we're replacing the levels of oxytocin that we become deficient in over time. What we're trying to do is we're trying to address an imbalance that has occurred somewhere along the way and give people back their normal levels of oxytocin. And by doing that, the oxytocin that we take in medication form will bind to the oxytocin receptors. Remember, I said that they're primarily present in the central nervous system. So when they bind there, they lock in and they cue the body up to do what it already knows how to do, which is one of the really neat things about that is, again, we're just replenishing it. We still have those receptors all throughout our body. They're just hungry for oxytocin, but we're not making enough, so we have to replace it.
Got it. Okay, and you kind of talked a little bit about the root causes, but there can be a deficiency of oxytocin.
Yes.
And so that is caused by a past trauma. What else could that be caused by?
That is one of the main offenders, is that if anyone has experienced trauma or long-standing chronic illness, what happens after a long period of that is depletion of something. A lot of times it's dopamine or serotonin. You know, you're feeling the long-lasting effects. Oxytocin is also one of those products in the body that we naturally make that we do become deficient in. So trauma is a really, really big one. It cannot be overlooked. Chronic inflammation is a really big issue that when we experience that long term, it takes an effect on the brain tissue, on the central nervous system, on the adrenal glands, which we talk a lot about the adrenal glands when we talk about hormone function, right? We think a lot about cortisol, which is important for helping our body manage stress.
Right.
So if you've been in, it can be anything from a very traumatic or stressful marriage, a very stressful job, long hours, burning the candle at both ends. All of these different things compounded over time can really deplete oxytocin in the body. But I can't leave this one out when I think about how toxic our environment is. When we think about BPAs, We think about plastics. We think about how much we are exposed to these certain types of toxins and what we call endocrine disruptors. They are disrupting the function of the endocrine system or the hormone system. Oxytocin can get imbalanced in those situations as well.
And you almost can't get away from it, right, today?
Right.
Okay, so I know this is a question of interest. What types of formulations of oxytocin does Physicians Preference Pharmacy have?
Yes. So as a compounding pharmacy, one of our primary goals is to customize the dosage form, of course, to the guest, right? So we're always taking several things into account. We're looking at the guest's lifestyle. Are they traveling a lot? Does their job demand a lot of travel? Are they home most of the time? These things are all important. What kind of dexterity does the guest have? Are they able to use a nasal spray device or not? So we offer it in a few different types of dosage forms. The nasal spray, which they'll use just usually 1 or 2 sprays in each nostril daily, or the sublingual tablet, which dissolves under the tongue in just a couple of minutes.
Okay. And those are so easy to take. Very convenient. Now, how about oxytocin, and how does that help with metabolism?
That's a good question. So there's a lot of different hormones that play very integral roles in metabolism. Leptin is a big one. That's what we think of as the satiety hormone. Or when you sit down and you eat a meal, how satisfied are you? And is your brain sending the correct signal back to the body saying, okay, it's time to stop eating now? Or is it not? For a lot of us, we don't get that signal. That's what leptin is. So insulin and leptin actually share a pretty intimate relationship with oxytocin. Oxytocin can regulate how those hormones work, which are imperative for regulating how our metabolism works and functions properly. So the leptin, which gets stored, and oxytocin can get stored in the fat. The more overweight somebody is, the more dysregulation of these hormones that they can actually have. So that becomes very important in managing how those hormones fluctuate, especially just prior to meals.
I feel like oxytocin is the wonder drug here because I also know that it can help with cardiovascular issues. So let's dive into that a little bit.
Yes. So oxytocin, again, its receptors are present in many different areas around the body, but also in the lining of the heart. So when we think about the cardiovascular system, we think about the heart and we think about blood pressure. We also have to think about inflammation, because we always are trying to combat inflammation in the cardiovascular system. Oxytocin has an anti-inflammatory benefit. So when it's sitting on the insides of the walls of the vessels and the lining of the heart, again, when we take it in from the outside in medication form, we're replenishing it, and it's going to those areas where the body is deficient in oxytocin and managing inflammation.
Okay. You had mentioned, some of the deficiency is caused by trauma or stress. So let's dig a little bit deeper into stress and relaxation. Can we help there as well?
Nice.
Yes, it does.
Yes, it does. Yeah, actually, one of the most interesting facts about oxytocin that I always like to share, because it fascinates me the first time I ever read this in the literature, is that for an adult who suffers from long-standing trauma, who has gone through major childhood trauma, even late into their adult years, they still retain, and we have the literature to back this up, they still retain those oxytocin receptors throughout their body. So again, those receptors are hungry. They want to receive the oxytocin. They just need to be given that, just kind of stimulation from the outside. So if we treat an adult who has had childhood trauma or chronic stressors with oxytocin, they will respond to it. So the receptors are still there. They just never go away. But when you were asking the question about which dosage form to use and which is best, if someone is having cognitive symptoms, and what I mean is stress, which is perceived in the brain, or lack of sleep, insomnia, depression, PTSD, anxiety, those symptoms that are experienced in the brain, we want to use the nasal spray because when we use it in the nose, it gets delivered directly to the brain tissue. And whenever we can give a medication that's delivered directly to the site of action, we will always have the least amount of side effects and the best benefit. So it's a win-win.
Is that brain fog as well?
Brain fog as well, which the reason that this can be actually helpful for brain fog is because long-lasting brain fog in particular can be a result of some of our immune cells being on overdrive, and that doesn't stop, which causes what? Inflammation. So if we can get the inflammation under control, we have better control over our mood, over our brain function, how clearly we're thinking, do we actually have clarity of thought, or is it a little bit murky?
Okay. So the question that people always want to know about, but don't always like to talk about, how can it help with actual sexual function?
Yeah, so this is a really good question. And a lot of times with sexual function products or treatment, we maybe get too locked into addressing one issue in particular. Oftentimes, there's several components to good sexual function. There's a functional component. How is the blood flowing, where it needs to go, when it needs to go there? But also, what about the psychological component? The libido, right? How do we get stimulated in a way that allows somebody or a couple to be intimate in the way that they want to? And then there's also that bonding after sexual activity that is important. Oxytocin plays a really important role in that. So a few of the different formulations that we offer at Physicians Preference Pharmacy are the oxytocin alone, but also in combination with other products that address different issues of why sexual function might not be up to par, so to speak. So we want to look at the brain function, the libido, our sexual drive. Also, we talked about the cardiovascular system. So blood flow is really important in good sexual health and function as well.
Okay, great. Thank you. Okay, so a little bit more about mental health. I mean, overall mental health and how oxytocin can play a role in that.
So when we think about mental health, we oftentimes think about depression, anxiety, social isolation is another big one, trauma. So whenever we have experienced any of those different types of conditions or situations for prolonged periods of time, like when we think about quarantining, it's a big one.
Yeah, we've
right?
just had a couple of years of that. Right?
Yeah. This social isolation will deplete oxytocin stores naturally. So that simply is a result of depletion of this very essential neurohormone peptide and how it works. So again, the beauty is, though, after we've been depleted in it, we still have the option to go in and replenish it and restore those levels to healthy levels.
Okay. It's interesting that it came up in previous conversations that it can also help potentially with ADHD in adults and children, or can you go into that a little bit?
Yeah. So part of that is the inflammatory potential. Also, with ADD, ADHD, there is a focus or concentration component where the thought processes can be very scattered. The attention to detail, the attention to a specific task can also be very scattered around for either adult or a child that's experiencing that. So we will use oxytocin as part of an entire regimen, but to primarily work within the brain tissue to maximize focus, maximize concentration. And again, I keep going back to it. The oxytocin receptors are so very densely found in the central nervous system, which the brain is part of the central nervous system. It's what regulates the whole circuit. So if we can start there, then the rest of the body's perception of anything that we experience is going to be more balanced, because the brain really controls the rest of the nervous system. When we're talking about pain, we're talking about how we respond to emotions or situations. Do we respond appropriately or inappropriately, right? Also, what's socially acceptable? When we talk about social interaction, there has been a lot of study with oxytocin in particular looking at and evaluating different factors of social interaction and communication, right? Eye contact, body language, how engaged are the eyes darting. And when children in particular, but also adults, take oxytocin, their social communication and interaction is better, both at home and at school. Because the diagnosis of those conditions need to happen in multiple places for a child in particular to be diagnosed. So we want to be sure that they're actually getting good benefits in both of those areas. It's very important at home and at school and at work, if you're an adult.
Just so much that can benefit confidence, just overall. Okay, in the last couple of years at the Wellness Center, we've seen many people who come in that have lost their sense of smell. And they just can't seem to recover from it. So can oxytocin help with this as well, and how?
That's a great question, Elena. We've actually seen a lot of benefit in our guests in this way specifically because, unfortunately, a few years later, there are still people who have not regained their smell. And there's kind of a few different camps of thought out there as why this happens. We obviously have a very rich, dense network of both vessels and nerves that come to the end of the nose and line the inside of the nose for many reasons, to protect the immunity, to keep the bad guys out. Of course, smell is really obvious. And for us to have a very acute sense of smell, we have to have good nerve function and good blood flow to the nose. So when we experience a viral infection, for example, there can be excess clotting, blood clotting, that occurs in that vascular network that's so dense in the nose, but also there can be nerve death. And so it can be both, but we need to be sure to get the residual clots or proteins that are building up in the nervous system out and evacuate them from the body, from the nervous system, because they're causing toxicity and death of those rich networks in the nose. And then by getting rid of those, we can actually restore the smell. Now, you can't just use oxytocin alone. There are other products you have to use in combination as kind of a protocol or a system. You know, you have a plan over several months, usually about 3 months, to really restore the smell, but people will see a benefit after the first few weeks and month. And then also using something like smell kits to retrain the smell is really important, especially if it's been several years that the person's been experiencing those symptoms.
Right. And how wonderful it is to get that back.
Absolutely.
Okay, so it's just amazing how everything's just tying together. And so what are some of the clinical considerations for oxytocin?
So again, when we talk about the guest compliance, that's a really big deal. So as a pharmacist, I always want to work with the guest and the prescriber to be sure we're choosing the right dosage form. So when we think about dosage forms, if you're somebody that travels a lot for work, or you're on the plane a lot, or you're gone for extended periods of time, the sublingual tablet is going to be a better option because it has, for example, a 6-month expiration date from the date it's compounded versus just a 35-day expiration date for the nasal spray. So first we want to look at what is the person experiencing, which dosage form is going to be best, but are they going to be able to be compliant with it? Because if you're not compliant with it, what's the point of getting started in the first place? Right. It's just not. Let's not even go there. Let's choose what's going to be best for your lifestyle and be realistic about it. Another thing that's very interesting about oxytocin is that it actually carries something called a positive feedback mechanism. So a lot of different mechanisms or systems in the body follow a negative feedback, which is a little bit like the thermostat you think about on your wall. You set it at a set point. Our body has a set point, which we call homeostasis, right? It's a balance. And when it gets above or below that, your thermostat corrects, just like our thermostat corrects. Our thermostat is our endocrine system, it's our hormonal system, it's our nervous system. It's a lot of systems working together. But oxytocin actually carries a positive feedback system, which means that when you start giving oxytocin to the person, again, exogenously or through medication form, the body goes, oh, that's right. I remember what I'm supposed to do with that. I can actually make more on my own. So one of the neat things about dosing with oxytocin is that over time, we actually get to generally dial back the dose rather than the other way around. You know, with a lot of mainstream pharmaceutical drugs, you will see that the dose needs to do what? Go up and up and up. But with oxytocin, we get to back down because your body recalls how to make more on its own. And then eventually you can come off of it is the goal.
So you're actually truly correcting
Right.
the issue.
Right.
And I've heard you say so many times, more is not better. So let's talk about that a little bit, because after listening to this, people will say, just give me as much oxytocin as you can. But let's talk about that.
Right. So we talk about the set point. We talk about the thermostat. It's very much that principle is that there are certain doses that we will start at when we begin dosing oxytocin in an individual. But Usually what happens is that, let's say if someone is taking oxytocin to improve their sleep, at first their sleep will be improved. If they were to continue increasing that dose over and over again, or just over time as their body starts making more on their own, their sleep might actually be disrupted to a certain extent because their thermostat has got tipped off. So that's how we know. We give them the tools to say, okay, when I experience this, I know I need to make a dose adjustment. Make sense?
Does,
Yeah.
absolutely.
So it's neat because the body will adapt to exactly what it needs.
Okay, so last but not least, where do our guests go to either order or have their provider order oxytocin?
Oxytocin, since it's a compounded product, is by prescription only, so it does require a prescription from your physician. We would be happy to fill that prescription at Physicians Preference Pharmacy. So we're available on our website, which is physicianspreferencerx.com. Call the pharmacy, talk with any of our pharmacists, and you can reach us at 281-828-9088.
Okay, well, thank you so much. This was very informative and educational as always.
Thank you, Lena. I appreciate
Thank you.
Thanks.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.